Hi, Kelly. Thanks
Hi.
for joining us today.
I'm so excited to be here.
We're so happy to have you here to talk about your whole journey and just reintroduce you to everyone. I was thinking we've known each other now for about 5 years, and just when you came in as a patient of Dr. Ashenoff's to now you being 5 years cancer-free, it's just incredible.
So exciting.
Congratulations.
Thank
and
you.
It's just been such an honor to watch your journey and see where you are now. So we couldn't be more excited to share your story with everyone.
I'm so excited to be here, and I cannot believe it's been 5 years.
I know.
Like almost 5 years with Plastic Surgery Center.
Yep, I think you're an honorary member of our team. When did you first get diagnosed? How did you first get diagnosed? Tell us about your symptoms.
I was a big advocate of going to my doctor. In fact, my mother would be like, you go to the doctor too much. And, they always tell you to do your self-breast exams and, to check yourself in the shower. And I always did that, and I never felt anything. And one day I sat on the couch and I folded my arms, and I was like, that was never there before. And it felt like a golf ball. Like, it was huge and literally appeared overnight. Besides that, I didn't have any other symptoms. And then, of course, knowing that it was there, touching it, it started to hurt. So then I go to Google, and Google actually told me things that were not correct, but they were very soothing at the time, and said that breast cancer doesn't happen in young women. I'm like, okay. Breast cancer lumps do not hurt. And I was like, well, okay, I'm feeling good, although, like, my gut was telling me, like, this is breast cancer, this is breast cancer. I can't stop touching this thing that I have. I immediately call my gynecologist, and I get in to see her, and she's like, you're young, you're 33, but definitely worth looking into. Let's send you for a mammogram. And as soon as they took that first image, everyone in the room knew that this was breast cancer.
Oh, I can't imagine just that initial fear and that initial reaction and just your head spinning a million different ways. So you said you were 33 when you first got diagnosed. Did you have any family history of breast cancer or anything like that?
No family history of breast cancer. Didn't test positive for any genetic mutation. It was just picking the short straw.
You literally just out of nowhere, and obviously, it can happen to anyone, but you never think that you're going to get that call or get that result from a mammogram. So it just goes without saying that self-exams are so important.
Yeah. And sometimes you just find something on accident. Like, I still remember it was a Sunday morning. Me and my husband just had breakfast, and I sat on the couch and I just folded my arms, and which was weird because I don't normally fold my arms. And yeah, it was like clear as day.
So what were the first steps after you got diagnosed? What doctors did you have to see? Kind of talk us through that initial process.
So it was kind of an interesting time for me. So I actually had a kidney stone at the time. Not my first kidney stone, I think it was like the second one that I had. And I really think that kidney stone was not leaving my body until I realized I had breast cancer. I was working at the time, and I remember I was in the office and I was in a lot of pain, and I ended up going to the hospital because I was just like, I've had this kidney stone for a month, I want to see exactly where it is. That was actually the day I was supposed to get my biopsy results. And I go to the hospital, they wheel me out to give me a scan. I come back and I have a missed call from my gynecologist. And she calls me and she's like, hey Kelly, it's so-and-so, call me back when you get a second. She's happy, she's upbeat, and I'm like, okay, this sounds good, And I call her and she's like, are you sitting down? You have breast cancer. And I was like, okay, like, all right, people get breast cancer, it's fine. And she's like, no, you have breast cancer and you need to find a breast surgeon immediately. And I owe everything to my gynecologist. She's still my gynecologist to this day. She's so amazing. And she says to me, I hope you're not mad, but I made an appointment for one of our breast surgeons at the hospital here. And I'm like, how can I be upset? Like, again, like being in this, getting a breast cancer diagnosis, being in this new world. I didn't have a family, like, again, because I have no family history. I didn't have like my mom to be like, oh, where should I go? Or what should I do? Or what steps do I need to do? And I was just so honored to have a doctor not just be like, oh, you have breast cancer and, you know, you're going to have to find a team. Like, she literally held my hand from, let's get this lump investigated. All right, it came back positive for breast cancer. I'm going to help you on your journey. It basically started from that phone call, and I'm so grateful to have such an amazing doctor with the connections that felt compelled so much to make those appointments for me.
Oh, absolutely. That's just like a weight off your shoulders in that moment. So when you went to the doctor that she set you up with, were you told what kind of cancer you had? Talk us through that portion of the journey.
That was really an out-of-body experience, and I think so many cancer patients will say, like, when you are diagnosed, the information is coming from this ear and going out the other, and you are not retaining anything. I had, my first appointment was with my breast surgeon, and my husband was there, my mom was there, and I remember my surgeon bringing up on her screen the images and going over what my treatment plan would look like, but I don't remember a lot of what she said because it was just, it was
Impossible to retain
very
anything.
hard to believe what was happening to me. Like, I was 33 when I was diagnosed. I was, you know, I think we were married for like 4 or 5 years at that point. I was, you know, climbing the corporate ladder in finance, and you know, we were starting our lives, and this totally 360'd me and changed my life so much that still to this day my life has not been the same since that diagnosis day.
Right, and I think everyone can say that's a breast cancer patient, that it's never the same afterwards. You know, it's something that forever changes you and makes you look at life differently. Who told you the kind of breast cancer you had, and talk us through that?
I remember meeting with my medical oncologist and went over my plan and said, you know, you have something called triple negative breast cancer, and going by the size lump that you have and your nodules that are affected, you're going to need chemotherapy, surgery, and radiation. So I knew I needed those 3 like right off the bat.
So describe in detail your treatment plan that was presented to you.
So I started off with chemotherapy. It was 6 months of they call it neoadjuvant chemotherapy, where that means you had chemotherapy before surgery. And I did 4 rounds of AC, they call it the Red Devil. Love that for me. I did 4 rounds of carboplatin, and I did 8 rounds of Taxol. Following that, I had a nipple-sparing, skin-sparing double mastectomy with delayed reconstruction. Once I healed from that, I went and got my weekly fills, and then I did radiation. Following radiation, I did another 6 months of oral chemotherapy with a drug called Xeloda.
Right, so, and then after that you were able to have your implant.
Yes, and then I was eventually
Perfect.
able to have my exchange surgery. I had tissue expanders for a whole 13 months. And luckily they weren't that bad. I know a lot of people complain about them, but
Yeah.
they weren't too bad.
That's great to hear.
Yeah.
And we'll get more into each stage that you just mentioned, but I think it's good for people to know the big picture, and just how long that all even sounds is overwhelming to hear. So I'm sure it was overwhelming for you to hear when that whole plan was presented to you. So let's go back to chemo. So the first step was chemo. What were your biggest challenges during that time?
Quite honestly, losing my hair. that was like, as a female, like, you identify so much with your hair, and knowing, I remember when I met my oncologist, he said, you got 2 weeks. You got 2 weeks until it starts falling out. And I actually started going to, as soon as I knew my treatment plan, I started going and getting blowouts every single weekend, because I knew I was never going to be able to do it ever again. And yeah, it's, as a female, it's very hard to lose your hair. It's very hard to look at yourself in the mirror, and you don't just lose your hair, you lose your eyebrows and your eyelashes, and you look fully sick.
Mm-hmm. And it's devastating to see yourself that way when you're already feeling not good, and then it just kind of all encompasses the whole gravity.
And it's a process, like the whole cancer experience is. And you have to feel your feels. You have to be sad about it. You have to be angry about it. And then you will come to acceptance with it. And then it was at that point where I was like, well, it is what it is. Don't have eyebrows. Don't have hair. I started having fun with wraps. And I went to a wig store and I bought everything that I liked. And
I remember you rocking those.
Yes, I had
you
a purple
good.
one, a red one, and I think I bought like a real human hair wig and all the upkeep that you have to do with that. But yeah, it's an emotional roller coaster. But you know, once you will get over that hump.
Absolutely. So regarding your double mastectomy, you mentioned that you had delayed reconstruction. Will you talk everyone through that who's not familiar, and you know, tell us the details about the mastectomy? I know you mentioned that it was a nipple sparing mastectomy.
So most breast cancer patients actually do lose their nipple, and a lot of their incisions are right across, which, you know, when it comes to wearing certain outfits or bathing suits, you know, you're gonna see very like close up that there's a scar there. I was actually very lucky, even though I was diagnosed with a very aggressive form of breast cancer. My tumor was actually very close to my armpit by my lymph nodes, and so if it's not very close to your nipple, you can save it, and they do a procedure called nipple sparing double mastectomy. And I was a candidate for it, which I was excited, because that meant that my incisions were going to be under the breast, almost like a breast augmentation. I had something called delayed reconstruction. Some people can have immediate reconstruction, so when they have their double mastectomy, they can have implants, or they could have their flat procedure done. Because I needed radiation, and everybody's case is so different. So in my case, my plastic surgeon was present at my double mastectomy. He placed the tissue expanders under the muscle of where my breast was, and we did the fills following that surgery, and just had to go through the rest of my cancer treatment and finished my breast reconstruction afterwards.
Perfect. So talk about the fill process when you have the tissue expanders in, for anyone who's not familiar.
So it's very interesting. So if I can explain what a tissue expander is, it's like a flat breast implant that there's nothing in it, and it needs to be filled with saline. And so you go to the plastic surgeon's office, usually go to the PA, see the PA, and they take a device, and there's a magnet in the expander, and so they have to see where there's like a little section on the tissue expander where the needle can go in to fill it with saline, and so they hold it up to your breast, and they find that there's like this little arrow thing,
mm-hmm.
and once they find where it is, they take a little marker, they mark it, and then that's where they put the needle, and it's like a little tiny baby needle. Like it probably, like, first time looking at it might look a little scary, but it's like a piece of cake.
Yeah.
Plus, after surgery, like, there's so many nerves that are cut, like, you don't feel anything. you know.
Right, you're almost like numb at that point,
Yes.
and just this is just something so simple compared to what I've already gone through.
Yeah.
Yeah.
And so you can either get like, I think 60 cc's or 100 cc's a week. It's totally up to the patient. Obviously, the more you do, the quicker you'll be done. I think I did about 60 cc's a week, and we did for 10 weeks, which is actually a pretty long time if you actually think about it. And I was fully expanded to 580 and then started my radiation. Going back, like, the two hardest things that I went through was losing my hair and preparing for surgery. I've never had a surgery in my life. I never had a stitch, anything like that, and I had to mentally prepare to lose my breasts. And to be honest, I put the decision off for the long time. Like, I would always get asked from my breast surgeon, like, what are we doing? What surgery are you doing? Of course, they tell you the best, course of action for your cancer type and your situation. But at the end of the day, you make the decisions. And I knew the best way to beat this cancer and to survive and thrive years later would be to get the double mastectomy. There was a couple options that were presented to me at first, breast implants and a flat procedure where they take tissue from your stomach and they put it in your breast. I didn't really want that. And that's another surgery, and you're in the hospital even longer. So I wanted breast implants off the bat. And I remember seeing Dr. Ashnoff at the Plastic Surgery Center, and plastic surgeons, they don't like radiation because it makes the job harder. And so being that I had to do radiation before my breast implants makes his job tricky. And so it was really important for me to take care of my skin because, yes, I have breast implants now and I have radiation. Not everyone gets to do that. Sometimes the skin is too thin. Sometimes there's an issue with the body and they have to go with the flap wrap. And so I really wanted breast implants, and so I researched what I needed to do with my skin. My radiation oncologist recommended a product called Aquaphor, and I read stuff day and night about how I should take care of my skin. And periodically I would have appointments with Dr. Ashnoff, and he would look and see how my skin's doing. He's like, your skin's doing amazing. And so it's kind of like, a two-person,
like you have to put work
plan
into
here,
it
it's
too, and
like it's
see how
not,
you're doing.
you can't all blame him. You got to put the work in too. And so I made sure that I had an extensive skincare routine. I was doing Aquaphor 3 times a day on my skin. You don't get radiation on the weekends. I made sure I continued that on the weekends, on my days off. And then I had 28 rounds of radiation, so it's like about a month and a half of treatment. When I finished, I continued, and I just kept going, and it worked, and I'm so grateful, and it made his job not as hard because, I did have that skincare routine.
Yeah, that's amazing. It's just like you knew what you wanted and you knew the work that had to be put into it, and not everyone can do that, but you were like, this is what I'm doing.
It's like I wasn't going to give up until, this is what I want, and I'm going to work really, really hard for it.
Absolutely. Is there anything you wish you knew before Reconstruction?
I will say that I was very lucky with what was presented to me. It wasn't until after my Reconstruction and cancer journey that I really learned about there are so many treatment options out there, like over the muscle, under the muscle. They can take tissue from your tummy, from your back, muscle, and all these sorts of things. And I had no idea. Or there's different ways they can cut. They can cut around the nipple, or you lose the areola, but the nipple is still there, and now there's like, nipple tattoos and all this sorts of thing. Yeah, it's amazing how far plastic surgery has come, and especially to help breast cancer patients. My plastic surgeon now was not my plastic surgeon when I first started out. I met with someone that was recommended by my breast surgeon, and mind you, I was still in the middle of chemotherapy, and she looked at my file and said, I would never give someone like you breast implants based on the fact that you need radiation. The only thing I would give you would be a flap surgery. And if I was an easygoing person, I probably would have said, okay, that's what I'm going to do. You're the doctor, I'm the patient. I don't know any better. But I'm very stubborn, and I'm like, no, nobody says no to me. I'm going to find someone that says yes to me. And enter Dr. Russell Ashenoff, who actually, that first appointment, that plastic surgeon took 5 minutes with me, broke my heart that I couldn't have the surgery that I wanted. And then I meet Dr. Russell Ashenoff, and he took a full hour. Actually, he took me before he started his day, that day. I'll never forget it. And he took a whole hour with me, and he goes, you want breast implants? We can do breast implants. But if it doesn't work, we have plan A, B, C, D, E, F, and we're going to go through it all. And I'm going to give you the result that you want and that you deserve. And I knew he was the one for me. And I've got boobies now.
I love you, Dr. Ashenoff. Thank you. He's the best. And I think, like bedside manner like that goes such a long way, and treating the patient like a person and a human being, not just a number that's coming in and out of your office, just makes all the difference. Because at the end of the day, this is something that you get back, and that you get to regain your confidence.
This is your life.
This is your life.
Right? This is your life.
These are your boobs.
These are your boobies. This is your body. And the decisions that you make during your cancer journey is so important. And it was clear that this was a ability. I went to a plastic surgeon that was giving me the surgery they wanted to give me. And then I found a plastic surgeon that I went to that gave me the surgery that I wanted. And so, I'm a full believer that, when things don't work out, they actually do work out. And I'm so grateful for, standing up for myself and demanding, someone else to see, like, is this true? Like, can I not have this surgery that I want? Especially the fact that, like, I was still in chemo, like it wasn't like they looked at my skin and they're like, oh, there's no way that we could pull this off. Like, you were basing something off of a piece of paper.
Right, and something that you didn't go through yet, and you didn't know what your skin would be like.
I am such a huge advocate of, asking questions, and just because they're a doctor doesn't necessarily mean that they're your doctor, or like they're the doctor right for you, because there are so many options out there. And, again, this is our body. Like, you don't want to do these surgeries and look back and be like, you know what? I should have went the other route, or I should have asked someone else.
Absolutely. And I think people just don't know to get a second opinion, or they're too scared or too unaware of the options. So, you doing your research was everything, and you getting a second opinion was everything. So getting into something exciting, talk to us about your health and fitness journey during your breast cancer treatment and afterwards.
So I was diagnosed with triple negative breast cancer, which is one of the most aggressive forms of breast cancer out there. We have the highest recurrence rates and the lowest survival rates of all breast cancers. And so when I was diagnosed with this, I wanted to know everything about this. Like, how am I going to beat this? I needed to find people that, survived this. And I read statistics like day and night. And I came across this one study that said women that are overweight at diagnosis have a poor prognosis. And that was me. I worked in finance. I was manager. I worked a lot of long days. didn't necessarily do things for me. Didn't eat well. I was overweight. Didn't exercise, and I get this cancer diagnosis. And seeing that my weight could make my cancer come back, I was like, no. Like every working woman out there that yo-yos with their diet, and their weight goes up and the weight goes down, and it's just like a vicious cycle until the day we die. I was like, no, this is it. Like, Kelly, like, you either lose the weight or you die. And that's it. That's all I needed. And funny story, because when I started chemotherapy, Jersey Shore came back on the air, and Vinny started doing keto. And I was like, oh man, like, that looks pretty easy. Like, I've done low carb. Like, keto was like brand new. This was 2018. And I remember, there's a rule with chemo. You can't lose weight during chemo because something could be wrong. And, you know, they pump you full of steroids. And, like, if you look at some of my old, like, photos of myself, like, you're like, oh my God, Kelly, like, my face was so big from all the steroids and all the drugs.
It's just like an amazing transformation. Like, it's crazy.
I look like, people will say to me, I can't believe that's the same girl from 5 years ago. And I said, if you have trouble believing that, what do you think I do?
You lived it.
It's crazy. And so I waited till radiation while I was cleared. I asked my oncologist, of course, that I wanted to, you know, diet, and asked him if I could go keto, and told me not to get crazy. And so I started, you know, following, you know, researching what to eat, because you, like any of these fad diets, like, you can you could follow it the wrong way or whatever. And the weight started coming off, and when you're undergoing radiation, you can be very fatigued and very exhausting. Like, you can even empty the dishwasher, if I can explain, like, how fatigued and how hard it is to move your body. And so I started very slow with exercise. And sometimes exercise just looked like me going to the mailbox and getting the mail. And sometimes it looked like me walking to the stop sign at the end of the street and walking back. And eventually I was able to move my body more, and the weight just continued to fall off. And I was so proud. It was like, there's nothing better than, like, when you're actually putting in the work and you're actually seeing results. But I will say, my proudest moment was, I didn't talk about my diet and my weight loss journey a lot with my doctors, because I wanted to impress them every time at my appointment. Because every time you go to the doctor, you have to weigh in.
And just the physical appearance of you was so obvious.
I was so excited to get on that scale. Like, I don't think people are usually
You're
excited.
like, here I come, I'm gonna
like,
march up on there. Yeah.
And yeah, it's funny, because it's like, still to this day, my team, you know, they're like, oh my God, you look so good, and you're healthy and all this. And, you know, it's funny. I'm going to totally, like, drop Dr. Ashenoff's name in here, because, like, I remember, like, going and having my appointments, and he's like, got skinny jeans on. Did you lose weight? And I'm like, you know I lost weight. I know you're afraid to mention it, but yes, I lost.
Yeah.
I lost.
Everyone's so scared to say that to a woman, right? Yeah.
Say it to me.
Yeah.
Come on. I will give you permission.
I want to hear it. Tell me how good I look.
Yeah, so I lost around, within like 5 years, well, 4 years if you continue start to finish, it's like 60 pounds. And so, yeah.
It's just unbelievable.
Yeah.
It really is just like a full transformation, and just seeing it like step by step, it's just crazy to see.
Yeah, it's crazy how, I mean, I think about what I went through with cancer and how tough that was, and emotional, and like, if you see me now, like, oh, Kelly's always happy, and she's, you know, doesn't have a bad day. That's not true. When I was first diagnosed, it was like the biggest dark cloud over me. Especially knowing, like, I was given a 55% chance that I would be sitting here. And, you know, I was willing to, I put in the work, and thankfully it ended up working in my favor. But, yeah, it come to a point for myself. I remember laying in bed and, like, just crying, and, like, this is it. like, this is, like, I thought I was going to live this long, full life, and like, I'm lucky that I'm still waking up. And you get this aha moment where it's like...
That's what I was gonna ask, like, what flipped the switch? And you're like, this is happening, I'm fighting this, and I'm working out, I'm eating healthy.
Well, what really flipped the switch was reading terrible stories on the internet. I would find, again, I say to people all the time, no one ever wants cancer, but thank God I got cancer during social media. However, in 2018, social media was not what it is today. Now you can't go on Instagram without finding breast cancer survivors or patients or any of that stuff. Back in 2018, only 5 years ago, you had to actively search hashtags to find somebody. Mm-hmm. And there was a lot of video on YouTube and stories and stuff like that. And I found people that had TNBC, and they were doing great. And then 6 months later, they were gone. And they're doing good, and then it came back to their brain, and they were no longer here. And I cried and was so emotional over that. And I said to myself, well, because I'm a very positive person, and I was like, well, I could either, what if I do have 6 months to live, right? I don't want to spend that time laying in my bed crying. Like, if I do lose my life because of this disease, I want people to remember me as the happy girl that she's always been. And once you realize that you are not in control, you are not in control of what goes on inside here. You may be able, like, I can't control whether cancer comes back or if, like, my cancer responds to the treatment, but I can control the way I respond up here. And that's when everything felt like, that's when the script flipped, mm-hmm. And it was like, well, what if that happens? I can't control that, let's go out there and live life. And, I'm grateful to be here and be that smiling girl once again.
And we're very grateful to have you here. Your whole story is so inspiring and just never ceases to give me chills, but I'm just glad that you had that aha moment and we're like, no, screw this, we're fighting this, and this is me. So yes. I'm gonna go down swinging if I have to.
And I'm so honored to be a patient of the Plastic Surgery Center. Aww. And meeting you 5 years ago and considering you a friend.
I know.
And you saw the good, the bad, the ugly.
Oh, yeah.
And all of that. And
yeah.
I'm so honored to have such a amazing practice that I can go to that that has seen me grow.
Yeah, it's unbelievable. Tell us about your involvement now in the breast cancer community.
So, going again when I was diagnosed with triple-negative breast cancer, I actively looked for survivor stories because I know if I found at least one person that beat this, I could hold on to that and be like, if you can see it, you can be it, sort of thing. Mm-hmm. And there wasn't much. There wasn't much at all. And it was 2019, and I decided to make an account on Instagram called TNBC Thrivers. And I actively searched the app for people with TNBC, and I asked them to share their stories. And in the last 4 years, it has blossomed into this beautiful community of people supporting each other, giving recommendations, surgery recommendations. What do I need? How do I prepare for my double mastectomy and radiation and this and that? And it's such an incredible community that just came from a hope to find at least one person like myself. And now I'm so honored to be the founder of the group. Yeah,
and tell us a little bit about what you guys do and how you organize some outings and just really cultivate that whole community factor.
Yeah, so it's kind of funny. So I put out there in my stories once that we should go to brunch, and people started DMing me. They're like, yeah, I'm local, I could come out to brunch. And we started doing Thriver brunches. We've been doing that for a couple of years, and you know, it's just like an amazing community. I also do Zoom chats, monthly Zoom chats with the Triple Negative Foundation, and just helping people in every step of their journey, like from newly diagnosed to in treatment. We help metastatic people and people, you know, cancer-free and years out, because when cancer treatment's over, cancer's not really over, and there's so many hurdles that we go through, and so many things that, you know, we do need support. Like, I'm a big believer that we are the generation talking about these things, because breast cancer isn't new, you know. It's not like a one and done thing. Like, you don't go through treatment and it's like, all right, that's gone. It's like things pop up. You feel pain in your back or your arm, and you're just like, oh, you know, is my cancer back? Like, I need someone to, you know, walk me off that ledge.
You'd be a sounding board and everything.
And, you know, one of the reasons why I love Dr. Eshinoff so much is that he's a lymphedema surgeon as well. And so that gives me so much comfort, because I'm at risk for lymphedema for the rest of my life. Like, thank goodness I have been doing so well and I haven't had any issues, but like, you know, things like that can happen. And yeah, that doesn't end when treatment ends. And it's, you know, there's people like me out there, people that need that support years after treatment's over.
Absolutely, because it's just not something that, okay, my treatment's done, my reconstruction's done, I'm good to go. It's, these things can pop up. You have to, you know, get checked for your tumor markers. You have to, you can have things like lymphedema that can happen years and years down the road. So I think, you know, you being an advocate for your community and making them aware of these things and what to look out for just helps prevent anything like that. And if it happens, what can you do?
And you're not alone, right? And so a lot of what you're dealing with, what you're feeling, like I was diagnosed with radiation fibrosis, which radiation is the gift that keeps on giving. And so my muscle on my cancer side is a little tight, and I also have radiation fibrosis on my left lung due to radiation. Most breast cancers are in the left breast, and if you get left breast radiation, your chance of getting radiation fibrosis is high. And so I talk about that, and a lot of people are like, wow, because like I'm dealing with that too, or I just got diagnosed with radiation fibrosis. Like, you're not alone, this is what I do, you know, this is what helped me. And it kind of feels, you know, like a lot of times, like when you feel like you're going through a struggle, like, oh, it's just me. Everyone else is out there thriving and their life is so much easier. Nobody has like any of these ailments that I have. And it's like, no, there's actually a lot of us. Yeah. There's a lot of us that have that.
Well, I'm sure too, the whole community is so grateful to have you and have you bring everyone together in that sense, because it's just so unifying and helpful to hear everyone else's stories too. So what would you like to see change overall in the way that breast cancer patients' journeys are managed somewhat as a whole?
You know, there's a lot of ins and outs, and not always your doctors prepare you. Like I mentioned before, I've learned a lot of stuff on social media with how to prepare and what should be done pre-surgery and pre-cancer. Like, I remember going through chemotherapy, and I was like, oh my God, I haven't been to the dentist in a while. You know, and once you're in chemotherapy, you can't go to the dentist because your white blood cells are low and you're at risk for infection. And then you hear about getting prepared for mastectomies, surgery, lumpectomies. What do you need? What do you bring to the hospital? How do you recover properly? These are all things that my doctors never prepared me for. They prepared me for what surgery to have and that I would need someone to care for me. But I had people tell me, like, oh, you need a recliner. And you need something to hold your drains, because you could have your drains for 2 weeks. You could have it. I had my drains for like a month. It was rough.
Yeah.
But you know, and
those are the little things that just someone should be walking you through every step and what you might need.
You know, I foresee having like almost like a nurse navigator, like how you get that at the hospital. Like someone tells you like you need a baseline before surgery. What is a baseline? Well, baseline is they measure your affected arm, the cancer side. They measure you, so when you have surgery, and you could get lymphedema at surgery, you can get it 2 years later, you can get 20 years later, you will know what you started at. These are things that I never knew. Or post mastectomy, you need to go to PT. You need to learn how to do certain strength exercises, because like I was like full T-Rex when like I could not move my arms at all, and it was Dr. Ashenoff that said, I'm writing you a script for PT, and I'm going to make sure that they are lymphedema certified, and you're going to get something called a lymphatic massage, and that they showed me different exercises and rubber bands and the wall, and so you, like you can actually like lift your arm like that, because like when you have surgery, like you're like here,
and like your range of motion is limited.
These are all conversations that your medical team doesn't cover, because they're your cancer team, right? What they think most important is, we're going to fight this cancer. We're going to get, you know, we're going to get you healthy again. But there's a lot of that falls in between the cracks, right? And information we find out later.
It needs to be like a cancer concierge. Like you need this. You need, like Dr. Ashenoff, a plastic surgeon, is telling you that you need to go to PT. Like you're just learning this almost like in passing. But meanwhile, some of your other doctors maybe should have came up with that, or it's just almost things that you're hearing about that's sparking like, oh, I should do this. But really it should be presented to you much sooner.
You could have skin changes during chemotherapy. I know I did. I had something called chemo rash, and I was itchy, and I had spots all over my arm. Anywhere the sun touched turns into hives. And you know, it almost became like, well, you know, we're the cancer comes first, you know, and you know, but we have to, it's important to treat the patient as a whole.
Right.
And so there becomes challenges that come along the way, and I was grateful to have a plastic surgeon that said, hey, you know, this is what you need, because no one told me. So I would love to see some sort of cancer concierge, you know, in like a cute little pink outfit, like, here I am, girl, I got you, and I'm gonna hold your hand for this whole thing, and you know, I'm gonna tell you what you need and where you need to go, and
not miss any of those things that slip through the cracks.
Yes, absolutely. It's because it's got to be like a whole approach to this, because you know, not every doctor in your team knows all these things, and so it's nice to have some. I would love to see something like that.
Was there any other procedure you had done during your swap surgery or afterwards?
Yes. So actually, my first procedure that I had done when I was diagnosed with cancer was I had a port put in, which is right there. So basically, if you don't know what a port is, it's where I got my chemotherapy. And so it actually sews into your jugular vein. And so as soon as I would get chemotherapy, it would go to my heart, and then it would pump the chemo throughout the rest of my body. Because I was high risk, I had to keep my port in for a while, just in case my cancer came back. And so a lot of people will get it removed at their surgery. I had to wait a little bit longer. So like I mentioned before, I had to wait 13 months to have my swab surgery. And I remember it was like a few months before that my medical oncologist said to me, like, oh, you should get your port out. You know, you just go to the hospital and just, you know, schedule an appointment. And then I see my breast surgeon, and she was like, if you want it to be done as beautifully and as delicately as possible, just wait until Dr. Ashenoff does it at your swap surgery. So that's what I did. And I had him take it out, and it's interesting because it took a little time to heal, and it actually, it was like purple. And I think Dr. Ashenoff hit it with I think they do like a was it a steroid shot? And it made it worse. It was like bright purple, and it was like, oh no, you know. And so he let me know that there is a laser treatment that I can get at the practice. I actually saw Dr. Yu, and I think it was called
It must have been the Alma laser.
Oh yeah, yes, that sounds about right. I had the Alma laser. I had that done, I think 5 times, and like, so basically, I've never had laser hair removal, but it felt like
I think
what
it's very
believe
similar.
is very
Yeah.
similar. It feels like a rubber band.
Yes,
hitting
that's
your
exactly
skin.
it. Yeah.
And there's different levels, and yeah, I had it 5 times, and yeah, it looks great.
It looks great. Was it painful or pretty tolerable?
I mean, it didn't feel fabulous, but I say, after having cancer, you can do anything.
Yes,
so, and
that
it's
is
very
true.
quick. It's very quick.
Yes.
So, if someone is not liking their port scar or, anything like that, there are options for you to, improve the appearance of your scar.
Absolutely. Well, Kelly, we're so excited to keep working with you. I know we have some more videos planned with you and some of our physicians, so I hope people keep sending in questions, and we're excited to keep on this journey with you.
I'm so honored to be here. And
Thank you.
Thank you so much.